Clinical anatomy of brachial plexus. Erb's paralysis. One region of the upper trunk of the brachial plexus is called Erb's point. 6 nerves meet here. Injury to the upper trunk causes Erb's paralysis. Nerve root involved. Mainly C5 and partly C6. Causes: birth injury, fall on the shoulder during anesthesia. Muscles paralyzed: biceps brachii, deltoid, brachialis, brachioradialis, partly supraspinatus and infraspinatus. Deformity: waiter's tip hand or policeman's tip hand or porter's tip hand. Arm hung by side and rotate medially. Forearm is pronator and extended. Flexible of the wrist and fingers. Disability: abduction and lateral rotation at the shoulder is lost. Flexion and supination of the forearm is closed. Absence of biceps juts. Absence of supinator juts. Sensation or lost over the lower part of the deltoid. Klumpke's paralysis. Site of injury: lower trunk of brachial plexus. Causes: birth injury, cervical rib. Nerve root involved: mainly T1 and partly C8. Muscles paralyzed: intrinsic muscles of the hand. Deformity: claw hand. Characteristic of claw hand: hyperextension at the metacarpal phalangeal joints and flexion at the interphalangeal joints. Disability: biceps and supinator juts are lost. Complete claw hand. Horner's syndrome. Clinical findings: ptosis, meiosis and hydrosis, enophthalmos, loss of cilio, spinal reflex. Vasomotor changes: the skin area with sensory loss is warmer due to arteriolar dilation. Trophic changes: dry and scaly skin is due to long-standing case of paralysis. Injury to nerve to serratus anterior, that is nerve of bell. Causes: carrying heavy loads on the shoulder, sudden pressure on shoulder. Deformity: winging of the scapula, that is excessive prominence of the medial border of the scapula. Disability: arm cannot be raised beyond 90 degree, that is overhead abduction is not possible.